the afternoon, and I would be remiss as a yoga therapist to not invite everybody, even though you've been sitting for an hour now, or off and on for many, to just stand up and take a stretch for a minute. Sitting is the new smoking, in case no one has told you this yet. And that means that we have an epidemic of musculoskeletal issues and conditions, even cognitive problems that are the result of sitting far too long. Memory happens in movement and in action, and that means that getting used to moving and even allowing yourself to move throughout the day isn't so much a bad idea. This is where standing desks and the like are coming from in our culture. But I'm not here to talk about movement per se. I'm here to talk about the brain and the work that we're doing at the ARPF in relationship to Alzheimer's disease. You can have a seat now. And for the conference organizers, I promise you, your mantra as a yoga therapist is, we have enough time, we are right on time, there is enough for everyone. So our mission at the ARPF has been for the last 20 years to fund research that's really dedicated at this idea that Alzheimer's disease can be prevented. And so to that end, much of the research that I will outline for you in this brief presentation of 20 years distilled into 25 minutes is going to be all around this notion that aging-related memory loss is something that we categorically reject, that it is not something that is an absolute nor a necessary, and so we are dedicated to preventing just that. So we know that the number one goal for the baby booming age is fundamentally to maintain a sharp brain as we age. It's to maintain a functional mitigation to this number one fear of getting Alzheimer's disease. And that means that essentially what any of us, regardless of our age, are really wanting is three core things. Number one, healthy longevity. Number two is a high quality of life. And number three is that peace of mind aspect that I'll talk about here in just a second. But here's the scary part, and I promise you this is not me trying to scare you into meditating, but 5.4 million people have Alzheimer's disease in the United States. 5.4 million. And there are over 10 million unpaid caregivers who are looking after these people. How many of you are a caregiver in some way to an elderly person? We've got 1, 2, 3, 4, 5, 6, 7 people in this room, 8 for whom this applies to. So this may not be a representative sample because we're a highly niche sort of environment here, but it at least gives you an appreciation of what that's like. It is the 6th leading cause of death in the United States. And as I said earlier, the number one worry. There's a new case every 67 seconds, which means since I got up on this stage, there's been at least 5 people diagnosed probably. So women are twice as likely to develop Alzheimer's disease in their 60s. A woman's lifetime risk for AD is higher than breast cancer. It's 1 in 6. And yet, 2/3 of Alzheimer's disease patients are women, and yet women so often don't seem to be representative in the Alzheimer's population as a whole. AD costs as much as heart disease and cancer combined. And really, when we talk about sort of lifestyle factors and prevention, we're talking about looking at cumulative stress. You can't talk about Alzheimer's prevention and not look at the cumulative effects of stress. This is a cartoon that I really love because it kind of shows you where tech and its influences upon our own organic selves has had some transference to this issue, which is, okay, your posture's great, darling, but relax, concentrate, and please let go of that cell phone. That accumulates over time to what we might call stress. The impact of a lifetime of stress is this decreased brain function, a loss of cognitive capacity. It decreases memory, it affects mood, it causes cellular and genetic health issues, which I'll talk about in just a moment with some of our telomere research, and it creates what we might call a mind-body-spirit imbalance. So stress increases, thus our risky behaviors. When you take, 150, 200 milligrams of caffeine at Starbucks on the way to work every morning, and then you combine that with sort of your technological addictions, overall that creates a certain character structure that's somewhat incompatible with your organic nature. And as a result, you start making quick, impulsive choices, like poor dietary choices. You're too damn tired to exercise. You're too exhausted to use any of these brain games. And there's no time to meditate, all of which, I will mind you, is a perceptive evaluation. Seldom is it based on truth. Because your well-being then, over time, becomes kind of inconsistent. You end up in these phases of well-being. How many of y'all ever been on a diet at some point in your life? That's like the majority of the room, right? So diet is one of our 4 pillars. I'll talk about diet in just a second. And of course, fundamentally, this leads to what we might call in the mind-body world unconscious compulsive self-defeating behavior, aka the blind spots of life. So the risk factors for Alzheimer's disease are pretty clear from much of the research that we've seen, both from our foundation as well as from the Alzheimer's Foundation themselves. The top 9 are listed here. Certainly, memory loss is one of the key indicators. That's why, functional memory assessments are usually one of the primary measures that we assess MCI, mild cognitive impairment, from. Inflammation is the second. When we look at research on Alzheimer's disease, we're looking at inflammatory markers as a biomarker to try to track it in some phasic way. Third is heart disease. Fourth is sleep. If you look at the Journal of Alzheimer's Disease over the last couple of years, you'll see several studies that look at sleep as a major contributing factor to indicators of Alzheimer's disease and early onset MCI. Diabetes, depression, immunodysfunction, GI issues, and we add this one here, loss of spiritual direction, as being somewhat indicative of what we're seeing a lot of our results coming from. This all happens genetically from what we call the shortening of telomeres. For those of you who don't know what a telomere is, it's these little DNA segments that are at the end of our chromosomes that essentially determine our longevity overall. So what can you do? I'll do a little exercise. I'm a body psychologist nowadays. I've given up. In many ways, I gave up this identity as a healthcare executive and went from what I say is the boardroom to the yoga mat for this very idea. That oftentimes what you're listening to me with isn't your whole self, it's actually your personality. I'll prove it to you. Are you noticing right now as you listen to this lecture the support of your chair? And as you do that, can you simultaneously listen to the support of my voice with the support of your chair, and can you feel the floor underneath you? Are you able to maintain dyadically that relationship between your own embodied self-awareness and my voice talking to you about all this Alzheimer's stuff as you're tracking the time, as you're also aware of the fact that you're still digesting lunch? See, the awareness field that we maintain can contract or expand depending upon our overall well-being. Whatever is the loudest thing in our conscious experience is usually what gets most of our attention. Pain, stress, those kinds of things are usually big amygdala activating kinds of signals. But the overall well-being things can only happen when that awareness includes everything, both you and me. In my field as a somatic psychotherapist, we call that embodied relational mindfulness. And what we know from AD's relationship to sort of the overall ideas of meditation is that while drug discovery, for the most part over the last 10 or 15 years, has remained rather elusive for us in Alzheimer's research, what we're now calling non-pharmacogenic interventions are actually quite compelling for what we would call the asymptomatic Alzheimer's population. That depends upon the 4 pillars for which that we fund research around. So anyone who's interested in funding, listen up. Number 1 is what we would call diet and brain-specific nutrients. And this has a lot to do with, yes, nutraceutical research. UCLA, for example, is currently looking at curcumin, which is as a amyloid plaque inhibitor. Amyloid plaque and tau tangles, for those of you who aren't in the know on Alzheimer's disease, are the 2 major indicators that start to eventually eat away at our cognitive function. So we're also looking at other supplementations that we're seeing that even the Alzheimer's Foundation is discovered, which is things like fish oil, omegas, and fatty acids. Stress management is the second pillar. That's your overall mental hygiene. And your mental hygiene has much to do with your day-to-day practices, your lifestyle. So we are so happy that for 20 years, the Alzheimer's Research and Prevention Foundation has been championing the lifestyle approach to Alzheimer's prevention. And finally, over the last 2 to 5 years, the literature is actually starting to reflect that. But we've been funding it for quite some time. The third you've heard a lot about, which is exercise, training. And that can be both cognitive as well as physical. Fourth is what we would call spiritual fitness, which is a combination of both psychological well-being and spiritual well-being. Sometimes in the literature, this gets combined as psycho-spiritual well-being, which is essentially what we would call spiritual fitness. It's semantics. So there's been a lot of published studies that reveal the multiple benefits of what we would say is that fourth component and one of the ways to address it, which we would consider to be meditation. And what we've researched in a lot of what can be found in our white paper, which any of y'all can pick up in the back of the room. It's outside those two doors. We're a little bit in the back of the bus, but you'll find us in the corner. And you can pick this up, and it'll have all of the studies that you're going to see here. So after my talk is over, feel free to stop by, and I'll answer any questions that you might have. But if you look at, for example, mindfulness-based stress reduction, most of those protocols are 30 to 40 minutes a day, right? If you look at any of the research. TM, transcendental meditation, those protocols are often 20 minutes a day, at least twice a day. But for our protocols, we've looked at accessibility and utility as being the most important, relevant aspects to whether or not people are going to be compliant with following through with a research protocol. So we've distilled it down to a 12-minute practice once a day, and yet we're still seeing major outcomes. The protocol is simple. It requires a breathing exercise, a certain posture that's maintained throughout the experience, a mantra that we incorporate, a mudra, which is a hand gesture, and some focus, which is a simple mental discipline, for 12 minutes every day. The mantra that we use comes from Sat Nam. It means truth is my name, truth is my identity. It's called Kirtan Kriya. It comes out of a long yogic tradition that I won't bore you with because this isn't a yoga conference. But how it works has much to do with what we understand to be kind of the essence of our physiology. Many of us learned about the homunculus when we were in anatomy class early on in life. We understand that a lot of the mantra aspects doesn't come necessarily from magical words. It comes from physiological connections that are in the upper palate of the physical head itself. So these are the before and after shots that we have from a 2009 study that we funded that I really wanted to sort of drive home today. What you're looking at up here is a brain image both before and after the utility of Kirtan Kriya in a set of researched subjects. Notice that the brain that's on the left is smaller, and it has dimples. And notice that the brain on the right is a lot smoother in the prefrontal cortex area up towards the front. This is the picture of a pre and post not healthy subject to a healthy subject, because essentially we're seeing increased cerebral blood flow. Now, lots of subjects have been seen to produce this kind of effect with what we would call the relaxation response. This is a very similar sort of mind-body outcome that we see in some of our literature. But we've taken it a bit of a step further. Another study that was done and published in the Journal of Nuclear Medicine in 2009 showed that this same protocol of 12 minutes a day shows increased uptake in the posterior cingulate gyrus. That's big because the PCG is one of the first areas to decline in function during the development of Alzheimer's disease. We also have seen changes in the frontal lobe. Pre and post our program, overall, only after 8 weeks, we saw that subjects' memory loss overall was reversed compared to our controls. So this was published in 2010 in the Journal of Alzheimer's Disease. We've also seen changes, as I said earlier, in the ACG pre and post in a second study that we followed up with a number of people. This is also in the Journal of Alzheimer's Disease. And then we looked at the overall functioning on brain function itself in 2009, looking at sagittal, coronal, and transaxial images of the protocol. But for the general audience, what I want you to understand that all of this, what this really translates to in the here and now, is that we have seen in our research that meditation fundamentally improves memory, diminishes our stress levels, reduces our depression, and boosts our overall telomerase activity, those telomere things that I was talking about earlier. When we look at more subjective types of outcomes, we see improvements not only in mental health and cognition, but overall in what we would call subjective well-being and even psychospiritual well-being. And the most promising of which was published in the Journal of Geriatric Psychiatry back in 2012, was our pilot study of looking at yogic meditation for family dementia caregivers with depressive symptoms. Because what we know when it comes to those that we can't reach, for example, those who already have been diagnosed with MCI, and they're not going to fall in that preventative category that we can do a whole lot interventionally with. When we focus on caregiver stress, it has a direct impact and benefit upon the actual patient themselves. And I'm sure that makes sense, because they become a proxy to much of the self-regulation of their loved one as the caregiver. So 43% is what we saw with ours versus a standard control of just general relaxation, of increase in telomere length. Enhanced well-being was seen from baseline to control to improve significantly in our subjective rating scales. But what is this psychological well-being thing that bald hillbilly guy keeps talking about? Well, it's about 6 things. It's about acceptance, independence, mastery, personal growth, positive relationships, and a sense of purpose and mission. So it's overall reducing some of those risk factors that were real scary in all those statistics that I gave you earlier. And it's this newest aspect that we are starting to fund out of our foundation, because we're really interested in how we can discover our best selves. And we consider that to be also translational of what we might call spiritual well-being. And that has 5 components. And that is patience, altruism, compassion, the ability to surrender to those things that we cannot control. You saw in my bio that I also work in addiction. And lastly is peace of mind. So where we are currently funding future directions is in the following studies. We just funded a study showing the slowing of progression of memory loss in subjective cognitive impairment and mild cognitive impairment. This is a study at UCLA School of Medicine who is collaborating with some translational research from the University of West Virginia. We're also helping fund the FINGER study in Stockholm in Sweden, which is the Finnish geriatric intervention study to prevent cognitive impairment and disability. And that's really driving those 4 pillars that I was talking about earlier as being essential to prevention. Also, the Einstein aging study at Yeshiva University in the Bronx is a community-based provider system. It's a community-based research project that's looking to identify factors such as stress and pain that serve as contributing factors to cognitive decline, dementia, and other health outcomes. But how does any of this information that y'all are getting today actually translate into direct experience that can make a difference in your life tomorrow? 6 things. It can easily be learned and practiced at home with a CD. It's super simple. That was our goal. 2, it strengthens the brain. Like going to the gym strengthens your body. Your mental fitness is just as important as your physical fitness, as many of other speakers throughout this conference have said to you guys. It improves your attention, concentration, focus, and memory. We've measured those things both subjectively and objectively in much of our data. Better mood, less depression, less anxiety, more mental and physical energy, and enhanced genetic health, i.e. those telomere things that we've been looking at. You can take this home. You can download it online. You can go to our website, alzheimersprevention.org. We're a nonprofit. We're all about getting the information out. We're not trying to sell you anything. All we want you to understand is that this is accessible. This is something you can start doing tomorrow, and that it will make a fundamental change in your overall well-being and in your life. The best time that we've noticed to do it from our research is first thing in the morning. It's very, very easy to do once you first get out of bed, because it kind of sets the tone for your day, as does any kind of mental practice. But overall, it's something that if you don't know how to do it and you don't think you can do it, I'd like you to come and find me at the booth back there, and I'll show you how I can prove that wrong. So any quick questions, because I promised I would try to catch up on time for you all, and that was rather rushed, but at least I was giving you that. Yeah. We don't have any of them here because of shipping and logistics issues, I think. But if you give me your information in the back, I'll make sure that you get one. Other questions? I am. That's still coming. I just wanted to give you guys a chance to interact before we go there. Yeah.
So, does your preventative approach help though with people who are already experiencing some of the?
Yeah. So what we see is that it depends upon staging, as does with everything. But even with those who've been diagnosed with MCI, we do see memory score improvement. Absolutely. With advanced sort of dementia cases, there's not enough cognitive faculty for us to have transference of knowledge for there to even be the ability to participate, though. All right, so as promised, find a comfortable sitting position. And just allow yourself to settle. And to settle means that you kind of let go even for this manufactured meditative experience. That means you put the gadgets down, you close the laptop, you allow yourself to find a comfortable sitting position, which usually means it requires the least amount of muscular efforting. So you might want to let go wherever you might be bracing. Some of us clench in our pelvis as a matter of habit. And if you notice that you're doing that, just let that go. Some of us like to suck our guts in because it's sexy. You can let that go too. Some of us like to hold our backs forward or too far backward, but what we want is a neutral pelvis that allows for a certain elongation of the spine. Whatever that looks like for you, it won't look the same as your neighbor, so I would invite you to inhibit any comparative judgment. Notice the quality of the sensations in your feet. And notice how that floor is supporting you. And notice the quality of that support and how it gives you this relaxed feeling. Now, we're going to simply chant the words sa, ta, na, ma. It's like singing yoga. That's the way I like to tell people that. And you'll follow, starting with your index finger and your thumb, you'll just touch your thumb with each syllable. So it'll look like this: sa, ta, na, ma. Sa, ta, na, ma. Go. Sa, ta, na, ma. Sa, ta, na, ma. You can keep going. Sa, ta, na, ma. And it's okay to close your eyes if that helps. Now, I want you to do it silently, but keep going with the finger movement. And that's it. You can rest. Satnam and Namaste. Thank all of you so much.